We're recording.
First off, I'd like to thank each of you for being here today. It was almost a year and a half ago my sister called and told me that Alyssa was really sick and that they were going to take her to the emergency room. Knowing my sister, I knew it wasn't just a cold and that it wouldn't go away. I knew this had to be serious. Alyssa was in the hospital for well over a week. It was like something off the hit television show House. After numerous tests, a young doctor from the infectious disease department went with his gut and began to treat her for Kawasaki's disease. I'm sure most of you are wondering, what is Kawasaki's disease? How does one get it? What are the symptoms? How is it treated? What effects, if any, does it have? And are there any awareness programs regarding it? Well, you're in luck because that's why I'm here today, to educate you on Kawasaki's disease. Kawasaki's disease is also known as lymph node syndrome. This disease was first noticed in Japan after the Second World War. Dr. Tomosuke Kawasaki, by far the highest incidence of Kawasaki's disease occurs in Asia, primarily in Japan and Korea, with 75 out of 100,000 children being diagnosed each year. In the United States, it is near 19 per every 100,000 children. Researchers believe that it is prone to children under the age of 5 years old. Additional risk factors in the United States include the Asian race and male sex. However, this doesn't mean that other genders and races are exempt. In such cases, my niece Alyssa Gombieski and best friend Jessica Gowdy neither are male or from Asian descent. There are many symptoms to the disease, but each of them by themselves would not cause a doctor to diagnose a child with Kawasaki's. In the case of Alyssa Gombieski, her mother stated that it started out with flu-like symptoms. She even took her to the family pediatrician, where he prescribed her antibiotics and then sent them home. However, my sister noticed that Alyssa was no longer getting better, she was actually getting worse. More symptoms started to appear. Alyssa developed a rash over her entire body. It included on her hands and the soles of her feet. And she also got a fever of 104 degrees for about 4 to 5 days straight. And then she got severely cracked lips, redness of her eyes. She had a strawberry tongue, swollen lymph nodes. And then when my little niece started complaining of pain and she wouldn't eat, my sister took her to the emergency room. It is very hard for a doctor to diagnose a patient with Kawasaki's disease because there is no specific laboratory test that can tell if a patient has it. The other issue is that many other illnesses, to include scarlet fever, can cause similar symptoms. In the case of Alyssa Gombieski, she spent 5 days in the hospital without proper diagnosis. The doctors ran several blood tests, an echocardiogram, an ultrasound, and a lumbar puncture to try to figure out what was causing her symptoms. After all the tests and no luck, a young doctor from the infectious disease department started to administer her with high doses of IVIG, which is intravenous immunoglobulin. They also gave her high doses of aspirin as part of her treatment. Aspirin alone is not as effective to treat it as IVIG. In rare instances, they are also given corticosteroids to help treat the disease. The acute symptoms of Kawasaki's disease are self-limited. This means that the patient will eventually recover. However, there are risks of coronary artery disease. Overall, about 2% die from complications of coronary artery disease, but they don't actually die from Kawasaki's disease, but from the effects that cause it on the heart. Most patients will be on an aspirin regimen for the rest of their lives, and in some extreme cases, like an instance with 24-year-old Jessica Gowdy, she is on the medicine of Coumadin for the rest of her life and has been since she was a child. This instance of this drug helps prevent her blood from clotting and causing her from having a coronary artery aneurysm. There are many awareness programs on the Kawasaki's disease. You can visit the American Heart Association website, and their website looks like this. And then you can also visit the Kawasaki Disease Foundation website, and they also have on here stories from other people who their children have suffered from Kawasaki's disease. Then And then the other thing is that New York State has also declared February 3rd through February 9th as Kawasaki's Disease Awareness Week. Kawasaki's disease is rare, but each of us should make effort to be educated on how our children can be affected by this disease. In such cases as 5-year-old Alyssa Gombieski and 24-year-old Jessica Gowdy, if there had been more knowledge on the disease, they could have been treated earlier and they may not have to be on medicine for the rest of their lives. They each have to have routine follow-ups and echocardiograms every year, 6 months, at every 6 months on every year, to see what damage it has still caused to their heart. And it may be possible that both of them may be taken off their medication. The main thing to remember about this is that awareness is the key to the disease, so to help spread the word about it. And thank you for allowing me to be here today and educate you on Kawasaki's disease.